Do you often wake up in the middle of the night with a sudden sharp pain in your big toe? It feels red hot and so tender that even the weight of a bedsheet hurts. If that sounds familiar, you might be dealing with hyperuricemia, a condition where there's too much uric acid in your blood. Think of uric acid like waste from broken down foods, especially meat and seafood. Normally, your kidneys remove it, but if there's too much or your body can't get rid of it fast enough, it turns into tiny needle-like crystals in your joints. This can lead to gout, a form of arthritis that attacks suddenly and painfully. It's more common in men, older adults, and people who enjoy rich foods or drink a lot of beer. So could your diet be sabotaging your joint health? What causes too much uric acid in your blood? Let's break it down. Your body naturally makes uric acid when it breaks down chemicals called purines. Purines are found in certain foods like red meat, organ meats, such as liver, shellfish, and drinks like beer and soda with high fructose corn syrup. Now, imagine your kitchen sink is your body. If you keep turning on the tap, eating high purine foods, and the drain is slow, your kidneys aren't removing uric acid well. The water uric acid overflows. That's hyperuricemia. Some people inherit kidneys that don't flush out uric acid fast enough. Others produce too much because of their diet, obesity, or health problems like high blood pressure or kidney disease. Even some medicines like diuretics, water pills, can make it worse. So ask yourself, are my favorite foods or medicines silently building up crystals in my joints? How do you know if you have gout? Picture this, it's 3 a.m., and your big toe feels like it's on fire. It's swollen, shiny red, and extremely painful. This sudden attack, often in one joint, is a classic sign. Gout usually hits the big toe, but it can also affect ankles, knees, elbows, or fingers. Some people say it feels like a broken bone or a bad sprain. Over time, if not treated, gout attacks can become more frequent and spread to more joints. In some cases, you might feel fine between attacks, but uric acid crystals are still quietly damaging your joints. Have you noticed lumps under your skin around your elbows, ears, or toes? These could be tophi, deposits of uric acid crystals. Or maybe you've had kidney stones. Both can be clues that your body has too much uric acid. Has your body been sending you warning signs without you realizing it? First, they ask about your symptoms: sudden pain, swelling, redness, especially in the big toe. Then they might take a sample of fluid from your swollen joint using a tiny needle. Under a microscope, they look for the needle-shaped uric acid crystals. That's the gold standard. Blood tests can help too. They measure your uric acid level. But remember, high levels don't always mean gout, and some people with gout have normal levels. Imaging tests like ultrasound or special CT scans can also spot crystals in the joint. For treatment, think short-term relief and long-term control. During an attack, medicines like ibuprofen, colchicine, or steroids reduce pain and swelling. For lasting care, drugs like allopurinol or febuxostat lower uric acid levels to prevent future attacks. It's like fixing the sink and slowing the tap. Have you tried to treat the pain without dealing with the real cause? That's like mopping the floor without turning off the faucet. Can you stop gout before it starts? Absolutely. Start by looking at your plate. Swap red meat and fried food for more fruits, veggies, low-fat dairy, and whole grains. Drink plenty of water. It helps your kidneys flush out uric acid. Try lemon water. Some studies say citric acid may help. Cut back on alcohol, especially beer, and avoid sugary sodas. Swap soda for sparkling water with lemon. Stay active and maintain a healthy weight, but avoid crash diets. They can spike uric acid. Think of it like car maintenance. Regular checkups, good fuel, and timely tune-ups keep everything running smoothly. Are you giving your body the care it deserves, or pushing it until it breaks down? Scientists are now making smarter tools to detect uric acid crystals without drawing joint fluid. For example, dual-energy CT scans can see the crystals in your joints like a heat map. New medicines are also in the works. One called Varinured helps kidneys remove uric acid better, often combined with allopurinol. Researchers are even studying the gut bacteria's role in gout, finding that some microbes affect how your body handles uric acid. Imagine a future where a probiotic could help prevent gout. Also, mobile apps now help patients track flare-ups, diet, and triggers, like a personal gout journal. Could technology be your new partner in staying pain-free? The future isn't just drugs, it's smart, personalized care.